Good afternoon and good evening, everyone. Welcome back to our third webinar. Thank you very much for being here during Thursday evening. We really appreciate all the feedbacks that we receiving. We appreciate your presence and we appreciate your engagement. I'm Bashir Musa from College of Medicine, and I'm looking after this program, and I'm full of energy and excitement every time we spend 1 hour together. And as I mentioned before, this program is supported by an amazing collaboration between the Emirati Diabetes Enterprise Society and University of Sharjah. Both great entities trying their best to produce different learning initiatives to help the learners, the researchers, the clinician, and the community in UAE. Today, it gives me a great pleasure to introduce our third speaker. But before that, please allow me to give some instructions related to the webinar. So right now, the webinar is live streamed on YouTube channels of the Society, Diabetes and Endocrine Society. And at the end of the session, we will be having Q&A time or period. So at that time, please feel free to send your questions through the Q&A chat box. As we mentioned before, the webinar is accredited, is CME accredited, and all the participants who are attending the sessions will receive the certificate by the end of the final webinar. So in this phase, we have about 6 webinars. Today is the third one, but after the 6th one, you will be able to get your certificate. I'm very excited to know that about 1,030 participants already registered, and right now we have about 310 people live with us. So let's talk about our speaker today. She's a very dear friend of mine, Professor Basima Siddiq. She's a professor of public health and epidemiology at Khalifa University. She holds a PhD in public health and community medicine from University of New South Wales, Australia. And she's the founding director, actually. And I'm very proud of saying that because I was a witness. I was a witness of all the journey that she started to kind of establish the Center of Excellence for Public Health and chair of public health at University of Sharjah. She was also a chair of the Epidemiology and Biostatistic Unit at University of Sharjah. She is an expert in different fields, including epidemiology, public health, community medicine, health information management. She worked across different countries, especially in research in UAE, Saudi Arabia, Lebanon, and Australia. Her key areas of research include burden of diseases, include impact of alternative tobacco and smoking products on health in UAE, effects of occupational exposure, globalization in emerging health threats. Also, she invested a lot of time in health information system, digital health for improving health outcomes. Also, she worked in mental health and public health crisis during crises such as COVID-19. She been awarded several awards, and she's a fellow of the Royal College of Physicians in UK. And she got several awards from University of Sharjah, University of New South Wales, and other universities. She's been recognized recently as one of the top 2% scientists globally, according to Stanford University database. It is a special and great pleasure to have you today with us, Prof. Basima. And today she will be talking to us about clinical research exploring the spectrum of studies designs. Please, the floor is yours, Prof. Basima.
Thank you very much, Prof. Bachayer, for this lovely introduction. You're very generous, actually, in your introduction. It gives me great pleasure being here this evening, supporting this amazing initiative, which I think is a great research building capacity program, which I'm sure will bring lots of good results. And I know that this is a continuation and there will be other also programs coming up. So I'm very proud to be part of this initiative. Thank you for the invitation. So I will just quickly share my screen. So today I'm going to be talking to you about exploring the spectrum of study designs. And this is really an area which is very dear to my heart, actually, because it gives me great pleasure when I'm able to at least disseminate some of the information that I know about designing research. And by no means, designing research is very comprehensive, and research designs is very comprehensive. And so when we talk about research designs, there's so many areas to cover, and I'm sure I won't be able to do all of it in just 45 minutes. But what I do hope to do this evening is to very quickly explain what clinical research is and why research design is essential for evidence-based healthcare, to highlight and differentiate between the main categories of study designs, to be able to recognize the common study types, which we all hear about, whether they're case reports, cross-sectional study designs, case control, cohort studies, etc., to identify the difference between primary and secondary research, to appreciate the role of qualitative research, which sometimes is overlooked in clinical research, as well as reflect on how study design choices do in fact influence the quality and applicability of evidence in clinical practice. So I know that sounds like a lot, but I will very briefly touch upon each one of these aspects in designing clinical research. And as you said, Dr. Bashair, doing research is is a very comprehensive step. But what we plan to do in this evening's session is maybe just give a taste of what research designs are, and inshallah, maybe in future, as has been discussed, we can go into more detail about specific research designs and, the specifics about each research design. We could actually design or have sessions just on each individual survey design. So before I start, and I'm sure you've probably done this in other sessions, I had the privilege of attending last week's session and to discuss what do we mean by research. So research is such a common term that we sort of use, and I have people, sometimes students come to me and say, I want to do research. And you say, well, why do you want to do research? Why is research important to you? And sometimes it's like the buzzword for research is so exciting that we don't really understand what we mean when we want to do research. But basically, when we talk about research, the definition of this is it's a structured inquiry. And it's a structured inquiry in which we utilize acceptable scientific methodology. And so what we're doing by using this scientific methodology is to solve problems and create new knowledge, which people can apply. So when we talk about research designs, what are we trying to say? Basically, it's a framework of a set of philosophies. And by philosophies, we mean approaches. So what specific approach am I using to actually undertake my research or to find answers to a research question? Research designs often use procedures, methods, or techniques that have previously been tested for validity and reliability and that are unbiased and objective. And the reason why I really want to highlight this is because when we actually think about designing research, they need to be valid, they need to be reliable, they need to be unbiased and objective. So what do we mean by this? So when we talk about philosophical approaches or approaches that we're going to use, we're basically asking, are we going to use quantitative research or qualitative research? And I think a lot of people already know what we mean by quantitative and qualitative. Quantitative meaning more numbers, numerical values, qualitative meaning more emotion, meaning more deep sort of information seeking. Validity means that the correct procedures that we are using are able to answer the question that we have. And I think this is a very common problem people have. Sometimes they use the incorrect study design to answer a research question. So the validity of that research is questioned because we have to ask, is it truly answering the question that we're out to seek to get answered? And if we don't choose the correct study design, this is actually a threat to the validity of the study. Reliability is meaning that whatever method we use or whatever design we use is actually consistent and accurate in measuring what we want it to measure. Unbiased and objective basically refers to when I actually think about a study design and the answers that I get from my study design, are the results I get fair? And am I drawing conclusions without any conflict of interest? Because I think as researchers, we all have a hypothesis or a hunch or an idea that we want to prove. And sometimes, I mean, we're all human. Sometimes we may want the results to be directed in a certain way, but we have to remember and remind ourselves that proper research means that our results and our interpretation of those results has to be unbiased and very objective. And so bias basically is when we deliberately attempt to either conceal or highlight something. So the reason I'm giving you this as an introduction is basically because these different aspects truly reflect the quality of what research means. So why does this matter? Why is it important that when we talk about clinical research, we need to think about these things and also about the type of research design we have to choose? Basically, it's because ultimately what research does is it underpins evidence-based decision making. And for the healthcare professionals that are with us today, we know that evidence-based medicine or evidence-based practice is that whatever decision we make is actually based on is based on evidence, sorry. And what we mean by that is that previous research has proven certain concepts, whether it's treatment, whether it's an intervention, whether it's a method. And so when we use evidence-based practice, it's basically meaning that our decision is influenced by the evidence that has been designed or the evidence that has been created. And so this is again why it's extremely important that research designs are valid and reliable, because ultimately the results from my research will determine what evidence will determine what decisions are made based on the evidence I'm going to supply. So again, highlighting the importance of having research study designs which are valid, reliable, and ethically sound. And so when we have actually a good understanding of the different study types, this allows us to evaluate journal articles. So a lot of us read research in order to make decisions or to determine a certain method or to determine or evaluate a specific intervention. Now, when I'm aware of the different research designs or what research designs mean, this enables me to actually evaluate journal articles, be able to do good research, and to be able to translate findings from my research into better patient care. So the research process is very long, and for those of you that have attempted or have done research will appreciate the long process in conducting research. So we start off with identifying the general study idea or area. We choose a research topic. This comes and goes, and I'll show you in a second what I mean by that. We plan and we formulate a specific methodology. We collect our data, we analyze and interpret the data, and we present our findings. So in a nutshell, the research process is extremely long. It's very exciting, and I always, I mean, the most enjoyable part of my day is when I'm actually starting to think about a research idea and how I'm going to develop a research idea into a proposal and so forth. But it is a long journey, sorry. And so for a research journey, there are two important decisions that you need to make before you embark on this research process. And the first one is, what do you want to find out? What is your research problem? What answers do you want to achieve from doing and conducting your research, and how to go about finding their answers? And this how is part of the methodology and is part of developing your research design. So The three significant parts of designing or putting together or embarking on the research process includes the first phase, which is deciding what, planning on how you're going to do the research, and then conducting and executing your research plan, which is the collecting phase. So what are the different steps in the research process? So we start off with identifying the problem, as we said. So what is it that I want to do? What is my area that I want to find an answer to? And again, this does not happen overnight. Usually it takes quite a bit of time because you start reviewing the existing literature. And then by reviewing the existing literature, it helps you identify. So you have an overarching idea, and then you start to think, okay, well, I know that there is a problem here, but what specific question in this problem do I want answered? What has previously been done? So we resort to the literature to find out what has previously been done. What do I need to do? What can I add to the literature? Where is the knowledge gap, we call it. And from this, I formulate my research question. So what is my research question? What are the objectives I want to achieve? What's the hypothesis that I want to test? What do I want to, I start to think about my hypothesis, to generate this hypothesis. So sometimes we call hypothesis, I tell my students, I call it the hunch. Remember, hypothesis is a research hunch that you have, or an idea, or something that you believe that you want to prove or disprove. And this often is generated from your research question and your objective. Now, it's very important at this point, we choose a research design that is suited to the research question. And again, this is where we sometimes go wrong because we choose research designs which are not properly suited to the research question that we want to achieve. We collect the data, interpret the findings, and then we report and publish these findings. So even though the previous slide was very nice and colorful and it seemed very simple, it's actually a very complicated process. And really, in our minds, when we're thinking about the research journey, this is what it looks like. And this is actually this is a good diagram in comparison to what goes on because there's a lot of overlap. So what happens in the first step, as we said, is we formulate the research question. And the research question keeps changing. So like I said at the beginning, you start off with a research question and you go and read the literature and you discover that someone's already done it, or that what you wanted to achieve is actually not feasible. So you go back and then you change your question and then you formulate again. So it's a coming back and forth to the research question as you read the literature. And so this is why the research question in designing research designs is really the starting point and the most important in developing research. And I say to my students all the time, your research question is the most difficult point. The research question and the actual, well, every phase has its pros and cons, I suppose, but the research question before you embark on that journey and actually know what it is that you want to do, unless it's something that you've experienced in your work and you know that it's a problem. So you're seeing an increasing number of children coming in with obese children, for example. And so you know that it is an existing problem and you want to try and investigate that it's from children with a particular ethnicity or a genetic issue or a lifestyle issue or whatever. So you know it exists, so you need to read more about it to actually try and address this. So this is what I mean by the research question. You have a hunch and then you read and then your idea then develops into the question. Then you go back to your methods and feel, no, I can't do this. This is not really feasible, or I don't have the resources. So let me mellow down my research question again. And it keeps going back and forth. And as you can see, it actually becomes a cycle. So after we've actually formulated the research question and problem, we start to think about the research design, which really that was just really an introduction to what I really wanted to talk to you about today. And so when we conceptualize the research design, this includes understanding the functions of the research design that I'm going to choose for my research question, as well as thinking about the advantages, the disadvantages, knowing about the different research design and which one is most suited to the research question or problem that I want to answer. So you probably are aware of the different research methods. And again, all of us want to do the highest level of research, but sometimes we have to come back down to earth and understand that it's not always feasible. So the different methods of research include things like experiments, whether our research is going to be exploratory, descriptive, are we going to look at secondary data and just analyze existing data? Are we going to generate or create a data from surveys? Are we going to do case studies? Are we going to use multiple methods? Sometimes it's very much possible to use multiple methods in the research that you want to do. So again, depending on your research question. So there are different types of research, and it depends on whether you're doing applied research, and so you're probably going to do pure research in the lab, applied research, or are you out to measure objectives, specifically looking at descriptive or exploratory research? Is it correlational research? Are you trying to correlate between two different variables? Is it an inquiry? So are you going to actually use more qualitative research? So you have to ask yourself these questions again. What is it that you want answered? There are different levels of research and data collection. And so we have primary research and we have secondary research. And primary research often means I'm collecting the data. So I am generating data for this research question. And these include things like RCTs, so randomized control trials, cohort studies, case control studies, cross-section observational studies, and time series studies. Secondary research often means using data which has been collected for reasons other than what you no, it's secondary data basically means it's using data which was collected for purposes other than your research. So it's looking at existing data, data from guidelines or data in clinical records or databases. And usually secondary research or secondary data analysis generates things like guidelines. It's when we do systematic reviews and meta-analysis, economic evaluations. But having said that, when we're using secondary data, we can also use secondary data to do case control studies or to do cross-sectional studies. And I'll explain that in a second. So you've probably all seen this diagram, which shows us the hierarchy of research designs, and the best level of evidence usually comes from systematic reviews and meta-analysis. So it's the highest evidence. And so when we use evidence from systematic reviews and meta-analysis, it means that we are going straight to the best. But this does not undermine the rest of those study designs in this triangle. Because depending on, again, the resources we have, the information that we have, we are sometimes obliged or not. There is no other option for us but to do a case report, for example, or to do a cross-sectional study. And this in no way undermines the results from these studies. In fact, what it does, it builds the knowledge and the baseline for other studies to actually do more sophisticated. So I always say that cross-sectional studies, for example, and we know the limitations, and I'll talk about some of those shortly. Even though they are maybe down the bottom of this triangle, but they're very important in providing baseline information to inform other studies, to inform a case control, to conform a cohort study. And so we shouldn't undermine using or starting with cross-sectional studies and other methods, which we shouldn't always just aim to go to the top of this triangle. So we have different experimental and non-experimental studies. And the difference between them both is that experimental studies is often when we look at cause and effect. It's non-experimental, we cannot assume causality, so we cannot prove causality between two variables. However, we can find associations. It can guide us to actually undertake more robust experimental research in the future. But as a first step there, we can always start with non-experimental studies. So descriptive research, and this is probably most research, basically describes the characteristics of a population, a phenomena, an idea, a problem, a situation that someone has. It always answers the question of what is happening. So what do I know about this? What do I know about diabetes? What do I know about cardiovascular disease in the UAE? And so a descriptive research study is the best starting point in order to answer some of these questions. It documents conditions, attitudes, behaviors without influencing them. So it's just documenting without really having any influence on the outcome. It does not involve any intervention or manipulation of variables. And it provides the basis for classifying data and for further questions. So it's always a good start. We start by doing descriptive research because it builds our knowledge base for more robust research studies. So examples of this include, so what is the prevalence of obesity among adults in Abu Dhabi in 2025? What are the demographic and clinical characteristics of diabetes, of patients with type 2 diabetes, for example? So these two questions are very much descriptive research questions. Exploratory research, on the other hand, is a systematic investigation of relationships among two or more variables. So it actually explores relationships between variables. And usually it's when one predicts the effect on another. So sometimes it's diagnostic, it's prognostic, and we reach these answers by exploring the relationships between results and patient outcomes. For example, they're usually guided by a set of hypotheses that help structure measurements and interpretation of findings. And often they answer the question of why or how is this happening. So it's as we said previously, descriptive is what is, this is why. So it's a further exploration of identifying relationships. And usually exploratory research can be done retrospectively or prospectively. And I'll talk about what I mean by each of these shortly. So an example is, what factors influence adherence to diabetes medication among adults in the UAE? Or what psychosocial factors contribute to smoking initiation among university students? So what is one factor, what is the role of one factor on predicting or contributing to an outcome? So prospective, I mentioned prospective earlier. Prospective basically means that variables are measured through direct recording. So I'm actually recording in the present. It's the now. So as I go along, I'm actually recording, and usually it's a following through of outcomes in a research study. So usually we follow through participants and see how they progress through treatment or evaluation or an intervention, so forth. Retrospective research, on the other hand, is usually looking at existing data, analyzing this existing data from the past. So I may have an idea of, I want to see I want to review the records of diabetic patient records from 10 years ago. So for the last 10 years, I want to identify what are the predictors for hospital readmissions among this patient group. And so it's going back in time, even though I'm doing it now, but I'm going back in time to actually identify trends or identify predictors on this specific outcome. Now, the researcher in retrospective research has no control over how the data were collected, and so this is sometimes a disadvantage because you have no control about how the data were collected. And so sometimes specific variables that would have been of interest to your study are lost because the data were collected for reasons other than your own research. So again, this is just highlighting what I mean by retrospective, prospective, and sometimes it can be both. Sometimes you can look at a study population, you can look at their data from 10 years ago, but you're also following them over for the next 5 years. So you're actually combining retrospective data collection as well as prospective data collection. These are the different types of research study designs that I will be talking about again in more detail. So we have observational and we have experimental. Observational incorporates descriptive studies, and analytical studies incorporates case control and cohort studies. Experimental studies, and I think most of you know, are things like clinical trials. So let's highlight what we mean by case reports or case series. So a case report is usually used, and I think a lot of the clinicians with us this evening will appreciate that a case report usually documents new medical occurrences, which often provide early clues to new diseases or adverse effects. And it's usually based on one patient. So it includes the patient's history, their symptoms, diagnosis, treatment, outcomes, etc. And it's usually quantitative or qualitative. For example, the first reported case of myocarditis following vaccination in one person. Or, for example, we used case reports a lot during COVID. For those of you that remember, we're in the early stages when we had no information. So a lot of case reports were actually being published because it started to give us information about the symptoms, the risk factors among patients that were admitted into hospital. Now, a case series is a number of similar case reports, and usually it's based on more than one patient. So it's the number of, so we have in the case report, we collected the reported cases of myocarditis following vaccination. Case series means I've collected up to maybe 5 or 6 cases of patients coming in following COVID vaccine, for example, who developed myocarditis. And so this becomes a case series. And usually this is a starting point to identify a problem. So it usually provides the preliminary evidence. So you can see if we go back to the triangle that I showed you, the hierarchy of evidence, even though case series and case reports are right down the bottom, they're extremely important in this hierarchy because they're actually providing us with the foundation. They're actually giving us this preliminary evidence. We won't go on and do further research unless we saw a trend. And the way we see this trend is by documenting it in case reports and case series. Now, the next study design in observational studies is cross-sectional studies. And I think a lot of you know what cross-sectional studies are. And although some people frown upon using cross-sectional studies, I personally love them, especially in the UAE, where we have a lot of information that is unknown. So there's so much potential for different areas of research. And unless we start with cross-sectional studies, we will not be able to develop and build these foundations for other studies and other more robust research designs. So usually cross-sectional studies are the best to determine prevalence of a condition. And it's usually a snapshot. And so always think of a cross-sectional study as going in at one point in time, taking a photo, and that is what you see. What you see in this photo is what the situation is. But we understand the limitation of this. It's not that we are assuming that this is going to be the same in 2 years' time. It's at this point in time. So we really make emphasis on this, that it is a limitation. However, it's also very important because it's providing baseline information to further inform other types of research studies. So for example, a community survey measuring the prevalence of hypertension and obesity among adults in Dubai. So this is a research question which can be very easily done using a cross-sectional study design. So think of a cross-sectional design as you have your defined population. So we have the population of the UAE. From this, I'm going to calculate an appropriate sample size, which is going to help me make representative information or findings on. And of this sample, I'm going to include everyone, those who have the exposure, those who have the disease, those who don't have the exposure but have the disease, don't have the exposure or but have the disease and don't have the exposure or disease at one point in time. And so it's just looking at everyone, then I'm going to ask them questions. Everyone gets the same data collection survey. We collect this information, or whether I'm looking back in time, it's at one point in time, and whatever I get, the results that I get, the descriptive results I get is what I report. In analytic study, and again, I know there's so much more that I can say about each one of these study designs, but I know that in the future there will be more detailed and comprehensive workshops to go into detail for each one of these. So this is just to be considered as an overview. So the next type of observational studies I want to talk about are analytic studies. So what do we mean by analytic studies? Again, similar to what we said about exploratory studies, and exploratory research. The analytic studies, it's very similar to exploratory research, but exploratory research can be qualitative as well when we're exploring. In analytic studies, it's most often quantitative and it's looking at the why and how. And so it actually has comparisons between groups. Usually there is a hypothesis which is tested, which is often generated from these descriptive studies. It identifies risk factors, causal links, and determinants of health outcomes. Now, the thing that we need to understand is that only experimental studies are able to prove causality. None of the what we do with analytic studies is that it's a stronger evidence of association than cross-sectional or descriptive studies. However, it is still not causation, but it is a stronger evidence, or it provides a stronger evidence for association. So, for example, comparing lung cancer rates among smokers and non-smokers to assess the effect of tobacco exposure. So, my research here is trying to understand whether tobacco or exposure to tobacco is actually increasing rates of lung cancer among those who smoke in comparison to those who don't smoke. Case control study, first type of analytic study I want to discuss. So the example I gave you about lung cancer is a typical case control study, for example. And basically what it is assessing the association between an exposure and an outcome. And so the way that we do case control studies is that we select our cases and then we match them with controls, and then we try and identify if there is an exposure. So I start to ask both the cases and the controls about exposure to determine the exposure. So often we choose our participants based on case. So we have our lung cancer patients, we have our non-lung or our other matched controls who don't have lung cancer. And I go back and I ask both the cases and the controls whether they were smokers or not to determine whether those who smoked have a higher risk or have a higher risk of actually having a lung cancer than those who did not smoke. Or another example is adults with type 2 diabetes, who are the cases, without diabetes, who are the control, and seeing whether there is a history of physical inactivity and sugary beverage intake. So is it more common? Is my research going to show that those who had that did not undertake or do any physical activity and had higher drinking sugary drinks, are they more likely to have developed type 2 diabetes? And so there's a lot of, in case control studies, there's a lot of bias that can happen. And so there are so many factors that we need to take into consideration doing a case control study, because we have to assume that our controls and our cases are matched on everything other exactly the same. So gender, age, history, ethnicity sometimes, and that the reason for the outcome is only due to exposure and nothing else. So basically what this means, if we think of this graphically, we have our defined population, we have our sample, then we choose them based on case, having the outcome or not having the outcome, and then we try to assess whether they were exposed or not exposed. And it can be done, or most often is done retrospectively. The next study design is cohort studies. And cohort studies is basically when I look at a group of people, so we call them the cohort, who share a common characteristic or exposure over time to determine if they develop a specific outcome. So initially, they are free from the disease, and they're usually grouped based on exposure. And we usually measure incidence, Incidence is the number of new cases that occur. Prevalence is the number of existing cases. And I haven't spoken about that, but just keep that in mind. So cohort studies can be prospective or retrospective, and they're usually providing a higher evidence or a stronger evidence for causation than cross-sectional or case control studies. So for example, following adults with and without obesity over 10 years to determine the risk of developing type 2. So the exposure here is obesity. Those who have obesity, those who don't have obesity, I've followed them over a period of 10 years to see whether they actually develop type 2 diabetes. And as you can see here, so again, we have our defined population, we select a sample, and then we choose our participants based on exposure. And then we follow them over a period of time. So longitudinal research, sometimes people confuse longitudinal research with cohort study. And the reason why they do is because a cohort study follows people over time, but they're selected based on exposure. In longitudinal research, it's basically a cohort study, but people are recruited to the study not having any disease or exposure or anything. It's just including people into a study over a period and following them up over a period of time, and then taking measurements, at every year or every 2 years to see what is the likelihood of developing certain diseases based on certain risk factors, but they are not recruited based on certain exposures. Experimental studies, which is, something that everyone wants to do, such as clinical trials. And we know that clinical trials are research studies where human participants receive specific intervention. So there's usually an intervention, and we try and measure the effect of this on health outcomes. And so usually we use it with new drugs, new devices, new behaviors, and usually, or we can also compare. So sometimes we compare a new therapy with a standard treatment or a placebo or no intervention. So for example, testing a new insulin formulation against standard therapy in adults with type 2 diabetes. And in graphically, if we want to think about this, it's very much similar to a cohort study. But in a cohort study, we don't have control over the exposure. The exposure already exists. In clinical trials, we are manipulating the exposure. So we are actually introducing the intervention. So whether it's a drug or whether it's an intervention of some sort, whether it's a behavior and so forth, and then we're following them up over a period of time. So this is, just think of it as a cohort study, but we are manipulating and having control over the intervention. Now, of course, each one of those study designs has its advantages and disadvantages that we need to keep in mind. And a lot of it is determined on what resources we have. And this often determines the kind of research study we actually end up deciding to undertake. However, having said that, it's extremely important that the right research design is chosen for the research question. So secondary analysis, as we said, is when we use existing databases to answer new questions. And we often look at different subsets to identify new relationships. It's quite cost effective. So sometimes people use secondary analysis, previous data that has been collected to answer questions because it's a lot quicker sometimes than having to do the data collection. Again, data collection can always take longer than anticipated. And so an example of this is using data from the UAE National Health Survey, for example, to examine associations between physical activity and mental well-being. Having said that, we need to ensure that the UAE National Health Survey does in fact collect data on physical activity and mental well-being. And then I come along and try and identify a relationship between these two different variables from this pre-existing data. And again, secondary analysis also includes systematic reviews and meta-analysis. And as I said at the beginning, these are the top of the hierarchy in terms of providing evidence. And usually it's a systematic review It's very different to a literature review or a narrative review, and I think sometimes people confuse this. A systematic review includes the ability to appraise, identify, and synthesize studies using explicit reproducible methods. And the methods to actually conduct a systematic review are often very rigid and need to be conducted according to certain methodologies such as PRISMA, and have to be documented in such a way that anybody can actually reproduce those methods. Any methodology actually needs to be reproducible, but especially so for systematic reviews. A meta-analysis is usually undertaking a statistical technique from the systematic review that combines results from these studies to produce a pooled estimate. And this is why it's considered the top of the ranking for evidence. And as I said, they're considered the highest level of evidence. And so an example of this would be combining data from multiple trials to determine whether lifestyle interventions actually improve glycemic control in adults with type 2 diabetes. And so again, systematic reviews usually incorporate randomized control trials, and then it's providing a pooled estimate from all of these different randomized control trials to come up with one pooled estimate to be used as evidence. And so conducting systematic reviews is quite tense. It's a very rigid methodology if you do it properly. Now, sometimes people say, oh, it's fine, I'll just do a quick systematic review and I'll have, it's not so easy to actually do, and it does actually take a lot of time and effort and needs to actually be follow a very specific and rigid methodology. Now, I quickly want to talk about qualitative research designs because I think sometimes we overlook this in the clinical research area. And I cannot, what's the word? I can never emphasize enough the importance of actually doing qualitative research designs. And it's actually being recognized now as a very important area of research because it actually captures the why and how of human behavior. And if you really think about human behavior, it has a big influence on health outcomes. And so qualitative research designs actually allow us to really contextualize and describe and look at deeply into some of these complex health issues that patients and individuals actually have. And there are different common designs, which I will not go into, such as fenomenology, grounded theory, ethnography, and case studies which involve in-depth exploration. And for example, a research question that can be answered using qualitative research design is something like exploring postpartum women's experiences who are accessing mental health support in the UAE. And this can be in the form of in-depth interviews, online forums, focus groups, web chat, surveys, so on and so forth. And there are many methods that can be actually used. So in summary, having said all this, in a nutshell, let's say, so in terms of designing a research design or a study design, we need to answer two questions. Will it include an intervention? If it doesn't include an intervention, then you're probably going to be doing an experimental study, which can be any of the RCT, different types of experimental again. If it's an observational, are you comparing? If you are comparing, if it's a comparison, it's a descriptive or an analytical. What direction? Is it retrospective, prospective, so on and so forth. So just think about all of these aspects in order to think about the study design that you will be using for your research. Again, quantitative basically looks at numerical, measurable data. It's objective, it's structured. We need a sample size. It usually includes different methodologies, different statistical tools are used. Qualitative is usually, again, descriptive, non-numerical. It looks at other aspects such as subjective understanding, behavior. Sample size is not usually an issue because we have something called data saturation. So once you've reached that point, sample size can be small, different types of data analysis, and so forth. So The key takeaway is when we're choosing the right research design for our research, we have to think of the research question that we're actually exploring. We determine our research design by understanding or confirming that the question we want answered is actually going to be answered using our research design. If it's a descriptive, it's going to be describing what is happening. If it's an analytical, is it exploring why and how outcomes occur? If it's experimental, it's testing interventions and causality. And if it's qualitative, it's understanding experiences and meanings. And always keep in mind that selecting the right design means balancing feasibility, ethics, and definitely scientific rigor. These are my references, and thank you so much.
Um, Thank you very much, Prof. Basima. It was very comprehensive as usual, and very detailed, and I think much needed. As you mentioned, it is an overview, and as you mentioned correctly, you will be part of the future phases as well when we talk about each section in a separate way. So, we're receiving several questions as usual in the chat box. But maybe I will go through the first. There is some questions related to the technical part of the webinar today. I will leave it for our technical team to answer that. But we have a comment or a question from Nazia. She said that I have done a research on impact of water pipe, tobacco smoking on lung function in young adult males in India. However, I would like to take it further in UAE population. Kindly guide me. So do you have any kind of advices or recommendation for this lady who wants to do this type of research?
Thank you, Nazia. I mean, for somebody who's very much interested in tobacco research, I think it's a very nice topic to investigate further. But I think also something we need to maybe highlight, Dr. Bashair, is the ethics concerned with doing and designing research. So, Nazia, I mean, if this is an area, so depending on what results you achieved in your previous research, are you able to build on this research here in the UAE? You need to take into consideration the population that you want to look at and the feasibility of actually undertaking such a research study. So what are you planning to do? Are you planning to further explore? Are you planning to do the same methodology on the UAE population? Are you planning to do you already have some concrete results using the same methods? Do you want to do the same thing here on the UAE population? So there are a lot of factors to consider, and you know, other than resources, it's also the feasibility of doing such research. So it's a bit difficult to answer your question specifically, but you really need to be very considerate of these factors as well. And then the feasibility again of the study design and the resources that you have.
All right, thank you. Thank you, Prof. Basimo, for that. We keep receiving a lot of questions, but the second question, how can we identify control candidates in case control studies?
Okay. So it depends. So for example, we have a case control study that we're doing at the moment. And a lot of the times, our cases were identified from hospital. So they're hospital patients. And so in order to ensure that we have the right controls, we have matched them with hospital controls as well. But patients who came in for something other than what the case is or what we're actually investigating. So, but I mean, this is because we have hospital cases, we're looking at hospital controls and we're matching them on age, ethnicity, gender, time of admission. So everything other than what they have, what the health outcome is or what the disease is. So hospital controls is very common. Community controls is very common. I also did another study where we had some negative controls and they were matched, sometimes siblings. Again, it depends on what it is that you're looking at. If you're looking at genetic factors, sometimes looking at the case in siblings. So you have the case and then you have their sibling who is very similar, but the only thing that's missing is the actual disease. So it just depends on the type of research question, but you can either use controls either from the community, from schools, from hospitals, depending on the type of question that you're asking.
Yeah, thank you, Prof. Basima. I do have a question from my side because, as you know, this initiative is to make sure that we're making things easier for researchers. And we want to enhance the researcher retention. So we want people keep doing research. So for a group of researchers who, may have limited resources, right? Fund-wise or, like research team, research assistants, time as well sometimes is part of the limitation. There is any specific study type or design that you recommend in such a situation?
I think ultimately, Dr. Bashir, most of us end up doing cross-sectional research because it's the easiest and less resource consuming, let's say, study design. But I think we need to move away from this slowly. As I mean, there's been some really amazing research that is being undertaken here in the UAE. So we now have the baseline data. We need to move to the next step. And so I think the key is, and this initiative, for example, opening up people's ideas about research and passion for research enables collaboration. And I think what's really important is that you need to collaborate. So, for example, as faculty or as academics, we don't have access to the data. Yes, we get access to the data by everyone has to undergo ethical approvals and get hospital approvals and so forth. But also working with someone from within the hospital who has access to the data, who can work with you and collaborate with you is really important. And so we have to move away from the silos that we're in. So academics only working with academics, physicians only working, clinicians only working with each other. We really need to start this, culture of collaboration for research to become easier and more accessible, I think.
Yes, and totally agree with that. And that's why the first phase of C.R.E.A.T.E is about awareness. We're inviting everybody to be in the same room. So we learn together the first part of the story, and that will kind of facilitate this collaboration, hopefully, in the
Yes.
future. I have another more kind of a specific question, I would say, from Binzar Maher saying when designing longitudinal observational studies, how do you approach balancing confounding factors with maintaining generalizability, especially in population-based public health research?
Wow. Okay.
Yeah, it's very specific. So it's about the longitudinal
Yeah.
observation study and how to balance between the
Yeah.
co-founders and the
Okay.
generalizability.
Yeah, generalizability is a very strong term, I think, because it becomes you can generalize when you have taken into consideration a proper sampling technique, so how you've sampled, how you've recruited into your study, especially in longitudinal research. Confounding factors are factors any variable that you have thought about is not a confounding factor unless you forget to account for it. So, for example, let's say I'm looking at a study, a longitudinal study, and I'm recruiting people and I'm doing the proper sampling. So, to be representative, it means that I need to, recruit people into the study from different areas in the UAE or in Abu Dhabi or Dubai or wherever. And I have to be representative. When I am representative, when my sample is representing the rest of the population, I can generalize. Now, in terms of confounding, if I have taken into account that the confounding or the typical confounding factors, things like age, ethnicity, genetics, so on and so forth, are potential confounding, and I have accounted for them, they're not confounders anymore because in research and in statistics, we can account for confounders and we can actually take these into consideration. So, I mean, that's just a very quick answer to that question. I can go on how we can actually address it. But I think the two key things is knowing about your confounders. When you know about your confounders, they're no longer confounders. And the way that we know about confounders is to read and to understand our area of research very well and to see what has previously been identified as a confounder to take it into account in our study and generalize if we've done the proper sampling and recruitment of participants and selection criteria, we're more likely to have a more general, we can generalize those results to the rest of the population.
Okay, thank you very much for this response. We have another question about narrative review article. They asking, do you think it's beneficial? This is from Umama, I think. Yeah.
Any,
Omnia Al Hassan. So what do you think of it? Is it narrative? Is it
of course,
the narrative review?
any any research or any publication that is adding new knowledge is beneficial. So we should never undermine any kind of research activity that is being undertaken. Doing a narrative review gives us information about a topic. It's consolidating all the different research or literature that is there. But a narrative is you're not synthesizing, you're not critiquing. In a systematic review or in a meta-analysis, for example, you're actually trying to bring down you're trying to consolidate and you're trying to not consolidate, sorry, you're trying to synthesize the results of the meta-analysis. However, in a narrative, it's more saying, okay, this is what we know, this is what is out there, this is what has been done. So it is still addressing a knowledge gap, but it's not a systematic review.
Okay, thank you very much. I have another technical, I think, question from Binzar Maher, and then we will go to a very interesting question. I'm so interested in the second one. This one is interesting as well, but he's asking specifically about the in low and middle income setting, where randomization is often logistically challenging. What strategies do you recommend to strengthen the internal validity in the experimental public health interventions?
Yeah, it's a good question because yes, I agree. We are restricted sometimes in conducting proper methods due to many factors, not just in low and middle income countries. I think research can be a challenge in any in any country. Now we know that with a proper experimental research, randomization is really important. Now there are other areas of experimental research which can be conducted where you don't need randomization. So, for example, instead of doing an experimental study, you might do a quasi-experimental study, which doesn't require randomization. Or is not a key element of the sampling. So I think we just need to be very aware of the different types and try to address them as we approach these problems. But yes, I do agree. Some of these factors can be very challenging sometimes.
Yeah, there is a very interesting question related to AI and how we deal with it. So, from your perspective, they're asking you, as a research expert, what do you think are the main advantages and potential drawbacks of relying on AI tools, such as conducting a literature review, for example?
Look, I think AI is something I think that we all need to start using. I will because it is where we're heading, and everyone is moving in that path. But I think what we need to be aware is we use it as a tool. It is not. We use it as a tool to help facilitate our work, not necessarily to replace the work. So, yes, a literature review can be written. I can go in and sit there and say to any AI tool, write a literature review about XYZ. However, it's not going to know how to critically analyze it. It's not going to know how to properly critique in that sense. So I have actually tried it, and I'm never happy with the results. It's not the same as I use it for check clarity. I use it for comparing. I use it for other factors, but it does not replace. It definitely does not replace, and it is not always 100% accurate, and we know that. Even with sometimes it can, if you, because we're using literature review as an example, it can sometimes give you the wrong references. It's not always correct, and unless I know this, I'm not going to be able to pick up those pick up those mistakes. So, for example, what you could do is you could read something, write a summary, and ask AI, for example, to help you rephrase it or to help you, but it's still your area, it's still something that you've read and you've become, you are very much informed about. And again, I think it's extremely important because when you do research because you're passionate about a particular topic. And the way you become passionate about this particular topic is by reading and understanding where the gap is. And the passion comes from when you want to fulfill that gap. If you are asking a tool to summarize, to write a literature review for you, you are not understanding where that gap is.
Mm.
Yes, you can ask it to summarize. You can say, okay, I want you to summarize this paper because I don't have the time to read it all. Summarize this. You can feed it different papers and say, okay, summarize for me. And you read those summaries and you come up with an idea based on the knowledge gap. This can very much help facilitate. So I think what we need to understand is that AI is supporting us, not replacing us. And I think this is something that we really need to take into consideration.
Yeah, thank you. Thank you very much, Dr. Basim, for that. And thank you very much, Rana, for this question. Actually, my intake on this, I always say that we are a bit sensitive to the word artificial, because it is, like something that's not good enough, I think, or it's not real. But I always say that whoever created artificial intelligence is a human intelligence. So I think it is like everything else, like PowerPoint, like the spelling checker, that when it first came, it was a big thing. It helped
Yes,
us to
yes,
do our job in a better way, but not
yes,
to replace us. And
yes,
people don't, you don't have to get very sensitive with the word like artificial. So
yes.
yeah, we're having more and more question, but because of the time, we won't be able to answer all the question. But there is a good news for you here, Basima. We have a young lady, I assume, Omalara. She said that she's interested in doing master degree program in public health, and she invites you to be her mentor and supervisor. So I would say, yeah, please, do you want to comment on that?
I mean, I'm always happy to support and mentor anyone who is interested in doing research by all means. I mean, if she wants to come to Khalifa University as an MPH student, she's more than welcome to join us.
Oh, okay. So we're receiving a lot of people saying thank you very much for an amazing webinar and for your time. And we will keep, that's what we do for every single webinar. We keep all the question aside so that we'll find another chance to answer all of them. But because of the time, we'll stop here. And again, I would like to say thank you very much, Prof. Basima, for sparing 1 hour on Thursday evening to be with us. That is so
My
amazing.
pleasure.
And
My
thank
pleasure.
you for being part of the journey. I remember very well you were so happy to be part of C.R.E.A.T.E in 2018. So you are part of the past, the present, inshallah, and the future as well. Thank you very
Inshallah,
much
my
for that.
pleasure. My
Thank
pleasure.
you.
Thank you so much for the
Thank you.
opportunity and thank you to everyone for your time. Thank you.
You very much. So we have just few points that I want to share with you before we end this webinar. Everything that we say today, for the people who ask for the slides or for the presentation, it is in YouTube, in the website of the Emirati Diabetes and Enterprise Society. For the people who are asking about the certificate, CME's credits, you will get it at the end of the webinars, of the first 6 webinars. And also you have to fill in an evaluation form that you will receive in your email. So please be tuned and look for that email. Our next webinar will be on Thursday again, 23rd of October, with our colleague, Prof. Rabi' Halawani. It will be about discover and share. So after you discover or you answer your question, how you can share that with the scientific community. We're having another two more after Prof. Rabi' webinar. We have Ethical Foundation in Clinical Research. We have Ethics in Action for Clinical Trials by Prof. Suhail. He's the Director of Ethics Committee at University of Sharjah. I'm very happy to share with you this announcement. We've been running a master program in diabetes management for almost 6 years. This year we receive our sixth batch, and it's a very successful program for any of you. If you are interested in advancing your career in diabetes care, please scan any of these QR codes, and you will find the information, you will find the program details, and you will find the contact there if you want to inquire about any of the details related to the master program. Also, the Diabetes Society, again, very active in organizing Young Leaders Forum. The next session will be on Wednesday, 26th of November. And also, they're doing a great job with the American Diabetes Association in making diabetes technology work as a program, continuing education program. As usual, I will end up with the very important announcement related to our very dear Congress edict on the 16th of on the 6th of February 2026. If you don't know about this, please find out about this amazing conference in this website. At the end, I would like again to thank all the almost 500 people joined us today. And for everyone who registered and who couldn't make it for whatever reason, we still have webinars, we still have chances to meet again and again. Wishing all of you a great evening and great weekend. Take care. Bye.
Bye-bye.
Bye-bye. Bye.